It's that time of year again. ACR Convergence 2024 is nearly here. Join us in Washington, D.C. from November 14th to the 19th and meet with colleagues from around the world. Enjoy thought-provoking sessions, listen to groundbreaking science, or join us for the Knowledge Bowl, Thieves Market, and the Image Competition. Register today at rheumatology.org. ACR Convergence 2024, where rheumatology meets.
Welcome back to another episode of ACR On Air, the official podcast of the American College of Rheumatology. I'm your host, Dr. John Hausman. Today, we're kicking off Rheumatic Disease Awareness Month, which is held every September. Joining us is Dr. Bhakti Shah, who will introduce us to the origins of Rheumatic Disease Awareness Month. We will discuss the need to improve awareness of rheumatic diseases, how rheumatic illnesses impact a patient's daily life, and she will introduce the concept of self-management, which can help to improve the control of rheumatic diseases beyond the medications prescribed. She will discuss the importance of empowering patients to take active roles in managing their diseases, and she will highlight resources available to make this happen. She also addresses how the ACR is advocating to improve healthcare policies and patient support, and how you can take part in these efforts. Dr. Bhakti Shah is a private practice rheumatologist in New York, and she serves as a member of the Communications and Marketing Committee for the American College of Rheumatology. She is also the New York City chapter leader for the Association of Women in Rheumatology. Dr. Shah treats a wide variety of autoimmune and rheumatic diseases and strives to incorporate wellness and mindfulness practice in her patient care. Enjoy. Bhakti, welcome to the show.
Thank you so much for having me, John. It's a pleasure to be here.
So it's September and it's Rheumatic Disease Awareness Month. Tell me a little bit about why the ACR decided to start this month to bring, awareness to rheumatic diseases.
Absolutely. So the American College of Rheumatology's Simple Task Public Awareness Initiative actually launched Rheumatic Disease Awareness Month in September of 2016 to raise awareness about the 100 plus rheumatic conditions that we take care of as rheumatologists. And during this time, what the ACR wants to focus on is really to increase the public's understanding and awareness of these symptoms and treatment options and overall lifestyle challenges that can occur due to these rheumatic diseases.
So, I think it's often not well understood that rheumatology is more than just arthritis. I think when the few people that I talk to that know anything about rheumatology, they think, oh, rheumatology, that must be like rheumatoid arthritis. But can you talk a little bit about some of the other conditions that we also take care of that are not rheumatoid arthritis or related to arthritis at all?
Absolutely. So I tell my patients that arthritis is really an umbrella term, and there are 24 different forms of arthritis. I mean, arthritis really means a condition of the joint. So yes, there's a rheumatoid arthritis. There's also psoriatic arthritis and spondyloarthritis, Lyme arthritis, just to name a few. But we also take care of conditions like lupus and Sjogren's syndrome, gout, vasculitis, myositis, osteoarthritis. So there are 100 plus conditions that we manage as a rheumatologist. But yes, when people think rheumatology, they think automatically rheumatoid arthritis, but that really is not the case. So I try to educate my patients on this as well.
Yeah, just last week I had a patient who was seen in another country and she was diagnosed with rheumatism. And then she came to me and said, I have rheumatism. I'm like, I don't know what that means. Some rheumatic disease, I guess, maybe not. But yeah, it's a word that is often poorly understood. And, we actually had an episode about the origins of the word rheumatology. So if you haven't checked that out, I recommend it.
Absolutely. The coin rheumatism was brought about by a physician in the 1600s. And that was just such a vague term to mean something related to essentially something. And that is something going on with the body with the joint, the muscle, but we truly understood the term rheumatoid arthritis and a lot of these other autoimmune conditions just really in the early 1900s. In
Wow.
1940, I think the term rheumatoid arthritis and rheumatologist was actually first coined.
Very good. So I guess it is important for people to be aware of rheumatology, rheumatologists, and the diseases that we take care of. So with the month of September, what is the ACR doing to try to increase awareness about our field and the diseases like rheumatoid arthritis and everything else we deal with?
Yeah. So, we chose this topic this year of self-management. In the past, we've had other topics, including reproductive health and just awareness on the standard of rheumatologic care across various states. The theme last year was on biosimilars, which again is a hot topic in the world of rheumatology. And we've had a variety of activations from celebrity public service announcements as well, with Jenny Garth and Terry Bradshaw, Venus Williams, who has Sjogren's syndrome. We want to bring awareness to rheumatic disease, and that is really the focus of this month. So we do this primarily by talking about the conditions.
Check.
We do podcasts such as this to bring more awareness up so patients can listen to these topics and gain a little bit more of an understanding that they are not alone. They are not isolated. There are over 50 million people in America that have a diagnosed rheumatic illness. And if you try to incorporate those that are undiagnosed, it's closer to 90 million.
Wow.
So yes, like 1 in 4 Americans has a rheumatic disease. And the more that we talk about it, the better their diagnosis will be, the faster they can get treated. And overall, we can improve their quality of life and decrease the burden of disability that these patients often endure.
So talk more about that. How do rheumatic diseases affect patients' lives?
Yeah, so there are so many ways, right? So rheumatic disease is often not visible. Unless you have a trained eye, you may not recognize that a patient has a rheumatic illness. But we know that rheumatic disease can cause a lot of pain and impairment. So patients can have difficulty doing basic daily tasks like opening jars or bottles or buttoning their clothes, driving. Walking is difficult for these patients, but when you have a chronic rheumatic disease, you can also deal with issues such as poor sleep, chronic fatigue, and this contributes to mental health issues as well. So besides the inflammatory symptoms that we see, even as rheumatologists, there are many other silent symptoms that often can be a larger burden for patients. And it truly depends on the disease that a patient has, right? A patient with rheumatoid arthritis has a very different outcome than patients with lupus or myositis or vasculitis. The symptoms are different, and that's what makes rheumatology such a complex and diverse field. There are truly no two patients that are exactly the same. So each patient deserves their own targeted, unique treatment plan that can adhere to their own limitations and the difficulties they're having.
So, Bhakti, you mentioned that the ACR is focusing on self-management for this year's RDAM. Can you talk a little bit more about what self-management is and how that helps patients?
Yes, of course. So self-management is just so essential for patients with rheumatic disease. This helps empower them to improve their quality of life through these very personalized strategies that are developed in conjunction with their healthcare team. So I just want to take a second here just to define self-management because it is often used interchangeably with self-care, but they are two very different concepts. So self-care is the tasks that are performed by healthy people to prevent illness rather than managing an active existing illness. Whereas self-management is really more of the day-to-day management of chronic conditions that can help over a course of an illness. So self-management is more of like this patient's ability to work with their doctor and or healthcare provider and create this approach that's really just beyond medications to help them live with a chronic condition, RA, lupus, osteoarthritis. And it gives patients this understanding that lifestyle changes and strategies can improve their well-being. And we can touch on that as well. But this is a very comprehensive approach. So outside of the medical treatment, there are physical, mental, and lifestyle changes that can be incorporated into the treatment plan to get better results. And we have studies that really do show that patients with rheumatic disease, they kind of lack this awareness and understanding that there are other ways to control their disease outside of medications. And we also have other studies that show that these positive, impactful self-management programs can have more benefits compared to just using medical standard care.
Yeah, and I think one of the benefits that I've seen of these self-management programs is that it really empowers the patient to be owners of their disease and their treatment, right? So it's not, I don't know what to do, like my doctor just tells me what to do. It's recognizing the symptoms, recognizing that either things are going well or things aren't going well, and having the knowledge of what it is that you need to do to get better. So it sort of puts the onus on the patient saying like, I can help, be part of the solution rather than victim of a disease.
Exactly. And I'm glad that you brought that up, because one of the things I tell my patients, especially when I'm giving them a new diagnosis, is I tell them, listen, you are not the disease. You are not lupus, but lupus is something you have. And while majority of autoimmune diseases don't have a cure, they do get controlled properly with medication treatments in addition to these other modalities that we'll discuss. Self-management can have many faces, and this can include just stress management, medication management, diet, exercise. These are things that as physicians and providers, we really do need to take that extra time to counsel patients on these things, because an insane statistic is that medication adherence, it's really not optimal. Only about 30 to 80% of patients take medications the way that they're supposed to. So if we rely solely on medications, we are not really going to get the health outcomes that we are looking for.
Yeah, that's a great point. I think medication adherence, it's a huge barrier to disease control. And, there's a lot of, it's not just the patient's fault. Sometimes we give them very complicated medication regimens that they have to take pills several times a day, or recommend injections that are, somewhat painful and uncomfortable, or even infusions that require them to, drive to the hospital and park and pay parking and, do all these things. So I understand why many patients have difficulties in medication adherence. And that's just like the tip of the iceberg, right? You mentioned a lot of other things that are probably even more difficult to do that are part of the self-management strategy. So, one of the things you mentioned was exercise. So how does exercise help or improve the care of a patient's rheumatic disease? And what type of exercise are you talking about?
Absolutely. So again, this varies on which diagnosis we are talking about, but in general, if there is just a rule of thumb that I tell all my patients, is that you really want to aim for about 30 minutes of physical activity 5 days a week, regular exercise. And this could be walking, jogging, swimming, weight training, any type of recreational activity that you want to do. And there have been numerous studies on the benefit of regular aerobic exercise, even in conditions like osteoarthritis and rheumatoid arthritis. What I try to remind my patients of as well is that their autoimmune disease, if it is not controlled properly, it ends up being a cardiovascular risk factor, similar to hypertension, diabetes, and high cholesterol, that we need to treat their rheumatoid arthritis or lupus as a cardiovascular risk. So the same advice that we give to our patients with high cholesterol, we give that advice to our patients with a rheumatic illness as well. This even includes a condition like gout, which most people do not understand is a big metabolic syndrome. And gout improves, the hyperuricemia improves with cardiac activity and with regular exercise. So I try not to make it complicated for my patients. I tell them, if you can just start by walking, aim for 5 minutes, then increase to 10 minutes, slowly build yourself up to 30 minutes a day, 5 days a week, and then you can add on whatever else in addition you would like to. We don't want to make things complicated. These patients are already dealing with a lot in terms of just managing their rheumatic illness. So simple guidance is what I try to strive for when I'm counseling my patients on exercise.
Bhakti, I think that point is so important. I mean, in all the research that has come out about health, wellness, longevity, exercise is always at the top as the most important thing that you can do for your health. And I think that's even more important in diseases that affect the musculoskeletal system, which, as we say in rheumatology, motion is lotion. So the more you move, the healthier those joints will be. I think one of the challenges that patients bring up is one, that they're tired, and two, that they hurt. So, do you have any strategies for overcoming some of those barriers when people are, they want to exercise, but they find it very difficult and painful?
Yeah. So if a patient tells me that they're too tired to, I try to encourage them by saying that exercise will overall improve their fatigue. It might be a little difficult in the beginning, but once you get started, you will notice that your fatigue does improve. But now, when the concept of pain comes in, this is where it gets a little tricky, right? If a patient has advanced osteoarthritis or debilitating rheumatoid arthritis, it's a little bit irrational for me to then tell them, well, go out and walk 30 minutes anyway. We then need to focus on how we can manage their symptoms in a more appropriate fashion. So there have been studies actually looking into more conservative, low impact activities such as yoga and Tai Chi. Now, I myself am a yoga instructor, so I can only attest to the great benefits that yoga can provide in improving the mind-body connection, but also to maintain flexibility and mobility through a low-impact movement routine. So my patients that are maybe a little bit older, that have a little bit more progressive osteoarthritis, I talk to them about chair yoga. Chair yoga, again, it can improve your strength, but doesn't require too much pressure on your joints. Ultimately, if a patient is really struggling with pain, we want to make sure that we are addressing their underlying pain, whether that be through optimizing their immunosuppressant therapy or adding proper pain medications to their regimen. But this is, again, self-management goes hand in hand with medical care. So we can't just do one exclusive of another. They both need to happen together in a very realistic way.
Absolutely. As you said, if somebody has rheumatoid arthritis that's not well treated, it's going to be very challenging for them to go out and exercise. So we need the medications and the management of the rheumatic disease and the exercise that comes later. And in this podcast, we've spoken with physical therapists that can help to guide patients in an exercise regimen that works for them. Because as you mentioned, if they have very advanced osteoarthritis of the knees or hips, maybe running is not a great exercise, but maybe the elliptical or swimming or some other less impactful sports can still be a substitute and can still get the 30 minutes of activities that patients should get.
Exactly. So care really needs to be tailored to the patient specifically. And physical therapy is such a great resource for patients because you can have a professional therapist kind of examine what your limitations are and kind of gear an exercise routine that is more suited for you. But this all really has to come from a patient and their physician or provider having a very open, honest relationship. Patients need to feel comfortable talking to their healthcare team about what their concerns are, what their limitations are. So I tell my patients, please go ahead and ask questions. One of the things I do personally is I don't end my visit with saying, do you have any questions? I end my visit with saying, what are your questions? Because when you say, do you have any questions? Patients might feel a little bit shut it down. Their appointment is coming to an end. They just want to end the visit. But when you say, what are your questions? It really leaves the door open for patients bringing up concerns and looking into what other options there are for their treatment.
I think one of the other important things about self-management is sort of being able to recognize when disease control is not going well and knowing what to do about it.
Yes.
And whether it's, I guess contacting, one of their healthcare team members, letting them know that their disease is flaring, increasing or adding medications or doing other strategies in trying to figure out how to tame that flare is important. What strategies do you tell patients about flares and identifying them?
Yeah. So I trust my patients wholeheartedly. They know their body best. They know their symptoms best. So I don't like to treat patients based on their number. A patient can have normal inflammatory markers, but they can have active disease. A patient's lupus numbers might look fine on paper, but we cannot treat our patients based on what the computer is showing us. We treat the person in front of us. So If a patient tells me that they are not feeling well, I take that at face value. And then through their symptoms and through physical exam, we determine exactly what it is that's going on. And if their RA is flaring or their lupus is flaring or they're having gout flares, we look at what the underlying issue is. Is it medication adherence? Is it new stressors that are coming in? I ask my patient, what do you think changed? I leave it as an open-ended question. What do you think changed? And a lot of times patients will say, listen, I was on vacation, I didn't take my meds, or I'm going through this big family stressor. And managing stress in rheumatic disease is important because we know that stress can cause inflammatory symptoms to be more pronounced. So if we want to talk about how we manage patients' flares, firstly, we need to leave the door open for a patient to feel comfortable to tell us that they're not feeling well. So I am not one of these doctors, and I know most rheumatologists don't just say, you're fine, you're okay, your blood work shows you're okay, so you must be okay. We need to listen to what our patient is telling us. And if they're flaring, we decide how to optimize their treatment by having a joint conversation with them and deciding what treatment would be most optimal. And then we talk about what we can do outside of just treatments to help improve their symptoms. So quality of life is going to be important here, because if there are certain things that we as physicians and providers will not be able to fix for patients, right? We won't be able to help them with their lifestyle stressors outside of what we can counsel them on. Family stresses, financial stresses, we can't do much on that end. But if we can give them the tools that they need to help incorporate various other aspects in their life, then outside of just medical management, we can help them get better results. So I also tell my patients about deep breathing and meditation. I mean, we don't have great data to say, hey, meditating 10 minutes a day will help to improve your RA. But if we understand what deep breathing and meditation does for just overall stress, we are giving patients an additional tool to help them manage their symptoms.
I love that. And, I'm a big fan of periodic fever syndromes and autoinflammatory diseases. And you are absolutely right that stressors, whether physical stressors or emotional stressors, are huge triggers. So, the start of the school year, final exams, a new job, a divorce, a death in the family, any of these stressors often trigger one of these autoinflammatory disease flares. And in addition to medications that we may recommend, I tell patients that they should try stress management techniques. And it's often easy to say, but it's hard to implement, right? So how do you actually tell patients to meditate or deep breathing? Do you have any tools or tips about how to get started?
You just get started. Patients will tell me when I sit and meditate, I start thinking about everything else. I tell them, hey, I do too. That is the way the human mind works. And when you partake in yoga or meditation, it's called a practice. My yoga practice, my meditation practice, because it is a very hard, it's not even a skill, it's just a very hard act to follow, right? It is very difficult to sit there in silence because we are not trained to be that way. We just want to be doing things and get things done off of our checklist. And that is why it's even more important for us to take those few minutes. So I tell a patient, just do it. Just get started. There are a dozen different apps. There's Calm, there's Headspace. Even if you just open up YouTube, there are guided meditation flows that you can follow. The first step is to get started. And with time, it will get better. But deep breathing has been shown overall to also help to reduce your baseline heart rate, just make you feel more at calm. It has been shown to reduce anxiety and depression and to stabilize blood pressure. And there are so many health benefits to yoga and meditation. So it is not that it is a necessity to do every day. We shouldn't be adding to patient stress by telling them that they have to do all these additional things. But if you find those 5-10 minutes, instead of scrolling on your phone or sitting in front of a TV, just take the time, close your eyes, and just try to incorporate a little bit of self-care. So this is self-care. We are incorporating within self-management because you can't do your best unless you're taking care of yourself. So patients that say, hey, but I'm taking care of my elderly parents and my children and my spouse. Okay, I tell them, I remind them, you will not be able to take care of them unless you take care of you first. And if a patient is able to prioritize their health, and if we empower them to use these tools, we are not only doing our part as their provider, but we are kind of acting also more as a friend, a confidant, just another source of encouragement to help them improve their overall health.
Great. One of my mentors used to say that it was actually a good thing for a patient to have a rheumatic disease and flare in times of stress because it's sort of a sensor telling you that you are stressed and having you acknowledge that something needs to change. Because many of us go throughout our lives not realizing that we're stressed. And then, we get to age 50 or 60 and we get a heart attack or a stroke. And so, the fact that you are stressed and your disease is flaring is actually, in a sense, a good thing, telling you, hey, look at what's going on. You're stressed. What can you do to reduce your stress? What can you do to prevent this going forward in the future? And in doing so, maybe even lead a much healthier life going forward.
Exactly. And that's why, this year with our campaign, we really chose to focus on self-management because our experts really identified research that says that self-management is not that prevalent in rheumatic disease, but that patients would really benefit from it. So we want to address this knowledge gap by talking to patients about management techniques and even talking to our physicians and providers about what they can do to help their patients kind of go along this more proactive role in their treatment journey. And, we talked about managing stress, which is a huge, huge thing that we talk to patients about as well, and medication adherence and exercising. But I want to also touch upon eating well. I mean, there is so much contradictory data and I'm going to air quote food experts that talk about anti-inflammatory foods. It's overwhelming for patients. It truly is. There is not a clear guideline on what type of food should you eat to help you feel better. So I tell my patients that just eat a healthy diet full of whole foods, good grains, and try to avoid anything processed. That is where, again, I leave it to make it least confusing and least complicated. Look for fresh fruits, fresh vegetables. Don't reach into anything in the freezer section unless it's really frozen fruits and vegetables. Try to cook at home as much as you can. And patients will say, but it's hard to cook at home. I know it's hard, but it is important when we're trying to eat well. Fast foods and pre-prepared meals, they are filled with preservatives and other junk and chemicals that are not really serving your body well. So just taking the time to make something for yourself, not only will it make you feel better about yourself, but it is overall going to be better for you. And there's been a lot of different diets that have been looked at in rheumatic disease. So what diet do we want to recommend? It's primarily going to be the Mediterranean diet. So Mediterranean and as plant-based as possible. Any type of specific diet, otherwise any of these like fad diets and these big treatment plans, I try to stay away from. I tell patients, follow a Mediterranean diet, incorporate as many plant-based options as you can. But eating well is such a crucial part of our management too. I mean, you are what you eat. They say you are what you eat. And food is such an important part of this as well, John. So I just wanted to make sure that we touched upon
Totally.
that.
And actually, one of the first episodes that we had, I don't remember her name, a researcher who is sort of created the ITIS diet, ITIS diet, sort of this idea of the anti-inflammatory diet. And yeah, it's basically a Mediterranean diet with some green tea added in for more like antioxidant support. And that's also what I tell my patients is that, a Mediterranean style diet is the way to go. One of my other mentors always mentioned, people ask, well, should I eat gluten? What about sugars? Or, what about seafood? And her take is like, look, if you eat it and it doesn't make you feel well, then stop eating it and try to eat, foods that are healthier. As you mentioned, there's no clear guidelines as to, foods to avoid or foods to eat in most patients with rheumatic diseases. But for a particular patient, they may do better without gluten or they may do better without sugar. So it's part of you have to listen to your body and see how your body manages various types of foods.
Absolutely. And, we are just touching upon the gut microbiome and its impact on the management of rheumatic disease. And we are nowhere close to really uncovering the secrets of the gut microbiome, but we do know that it is very, very, very important. But we all have a different gut microbiome. And that is the same advice I give my patients too, is that if they have specific questions, I tell them just try doing an elimination diet. For 1 month, go gluten-free, see how you feel. For 1 month, go dairy-free, see how you feel. Go nightshade free for a month, see how you feel. Because all of our bodies are very, very different. What's inflammatory for me may not be inflammatory for you. So it is really just about kind of fine tuning your own diet and lifestyle to whatever suits your needs. And this goes back to us empowering our patients. Listen to yourself. Your body is not lying to you. This is not all in your head. Be honest with yourself and honest with your healthcare team. And that is how we're going to get the most well-rounded results.
Great. So you've spoken a lot, about very important themes as part of this self-management strategy. You addressed exercise, stress, adherence to medications, foods and nutrition. Other tips? What about things like sleep?
Yeah, sleep is so complicated, right? Sleep is very, very difficult to address because not only are there many healthcare problems that can lead to poor sleep, such as obstructive sleep apnea, but sleep hygiene is a discussion I have with patients too every time they bring up the fact that they're not sleeping well. One of the first things that we want to do is make sure that they don't have sleep apnea. So I ask them, do you snore at night? Is there a loved one that sleeps close to you that tells you that you wake up with difficulty breathing or that you're trying to catch your breath? If that's the case, we send them for a sleep study. If that's not the case, we go over sleep hygiene. Are you drinking coffee? Are you watching TV before bed? What do you do to help yourself go to sleep? Are you drinking Coke, soda? So I go through this whole algorithm with them. And ultimately, I give them a few different pieces of advice. The first one is do not drink anything caffeinated after 12 p.m. Again, this is not data-based. This is pure experience-based. I want to make that very clear that this is just experience-based. After 12 p.m., no caffeine. An hour before bed, no screens. That includes TV. That includes your phone. There are some sleep experts that will say even 2 hours before bed. No blue light, no screens. When you are watching TV or looking at your phone, you're stimulating your brain to keep absorbing information. That does not allow your brain to quiet down and give you peaceful sleep. And the third thing I'll tell them to do is just find something that helps relax you. So that could be drinking a cup of chamomile tea. It could be reading a book. Could be doing a meditation exercise or doing some deep breathing. Or it could mean just talking to your family and your loved ones, just having some quiet time can also help to calm down the brain. Ultimately, some patients need medication therapies to help them sleep. And if that's the case, we go down that road. But there are many changes that you can make prior, which I really put into the category of sleep hygiene to help patients get better, restful sleep.
Great. Yeah. Other things that I've also done myself, I've actually heard from other podcasts is, the importance of going out into the sunlight in the morning and getting that light to your eyes, telling your brain that it is morning, and going outside and doing that for, 10 or 15 minutes tells your brain that in 12 hours, it should start secreting melatonin, and it may help to regulate your circadian rhythm and your sleep. Also, my wife is pretty adamant about turning down the lights in the evening so that my kids don't get more stimulated, as you mentioned, by that bright light coming into their eyes, and the brain is going like, what do you mean it's 8 p.m.? It's bright outside. This must be daylight. Time to go jump. And like you said, I think avoiding, the screens before bedtime is huge.
Yes, and exercise also helps to promote better sleep.
Absolutely.
So we have plenty of data to show that too. So this goes back into exercise, and there's so many things to counsel patients on. It can often be difficult for the physician or provider to talk to patients about all these things. And you don't have to necessarily talk about everything every visit, but listen to what the patient's needs are. And you can kind of target your conversation based on what you think that they are lacking in the most. If I have a patient that does CrossFit 5 days a week, I really don't need to talk to them about improving exercise, right? We can talk about other things as well. So these are just general tips and strategies that we as healthcare professionals can give our patients. And, whether that's the stress management, that's medication adherence, lifestyle changes. And one other thing that I always tell my patients about is maintain a support group, because you want your friends and family close by if you are flaring, particularly. If you really are not feeling well, you need that extra support. Don't try to do things alone. Rely on your family and friends. And having a rheumatic illness can also sometimes feel isolating. So I advise my patients, hey, join your local Facebook group. There are many support groups that you can join. There are lots of foundations that you can join, the Lupus Foundation, the Sjogren's Foundation. There are lots of organizations as well that patients can partake in to make them realize that they are not alone. And oftentimes patients will find something interesting in their support group and they'll come back and ask me, hey, do you think I should do XYZ? Will that help? And this gives them additional tools and resources as well. So make sure that you have a good group around you, some family, some friends. You are not alone. We don't want you to feel alone. When you feel like there's a community near you that's supporting you, you are also more likely to succeed in your treatment.
Bhakti, I was just thinking that, all of these self-management tips and tools are good for physicians as well, right? To eat well and exercise and sleep well and all these things, I think would benefit most of us. So what resources is the ACR providing for, patients or physicians or families that have people with rheumatic diseases about self-management and tools and tips about how to empower patients to take better care of their rheumatic disease?
Yes, that's great. So the official website of the American College of Rheumatology is rheumatology.org. And for Rheumatic Disease Awareness Month, it's RDAM.org. And here is where we house a lot of the informational materials for patients and families. So we have about 100 plus fact sheets on diseases and treatments that can be just important information for family members and patients alike to download, print, and view. Your doctors and providers should be reviewing a lot of this with you, but this is just some additional information that you can have there. There are blog posts as well that are on the website that address various different conditions. I've written some on, like psoriasis and the impact of the sun and vitamin D and different supplements, and a lot of the other ACR physicians and additional blog posts as well to review many other facets of the field. Our wonderful ACR On Air podcasts are also housed on the rheumatology.org website, so patients and family members can learn more about diseases from physicians and experts in the field and get more exposure to medical care as well. There are infographics, there are videos on various topics ranging from reproductive health, juvenile arthritis, use of cannabis for treatment of rheumatic disease. So these are all housed on the patient resources page on our website. So I guide my patients and their family members. If I don't print out these things myself and hand to them, I will guide them to the main rheumatology.org website where they can have access to so much more information as well.
Great. And we'll put all these links in the show notes so that, listeners can get easy access to these resources. What advocacy efforts are being undertaken during Rheumatic Disease Awareness Month to try to increase awareness, not just to patients and rheumatologists, but to sort of the broader world?
Oh, John, we are doing advocacy work year round. So on the ACR website, the rheumatology.org, patients can actually engage in advocacy themselves by sending letters to their representatives and senators to help bring about change. So currently on the website, there is a templated letter that you can then use to send this message to your local representatives to bring about legislation for reform to PBMs or pharmacy benefit managers and step therapy. I'm not going to really get into the nuances of that, but there is always room for advocacy. So I partake in advocacy work. I've met with representatives to discuss these issues to help make medications more affordable for patients. But patients can also partake in this. So awareness is really the first step to bring about change. So during Rheumatic Disease Awareness Month, we want to encourage patients to share their story, because if they don't share their story, they're not talking about the problems that they have faced. And if we don't talk about what we are dealing with, both as physicians and patients, we are not going to bring about the legislation that we need to help get our patients the therapies that they deserve. So while we do advocacy all the time, all year round, this month, we really want to encourage everyone to do their part in helping to bring about change. Every rheumatologist, every provider can partake in advocacy. It's such an important part of medical care that we don't talk about enough.
Awesome. And how do you envision the landscape of rheumatology changing or evolving over the next 5 to 10 years? What's going to be different and what do we need to do now sort of to be ready?
Oh, goodness. Just let your imagination go wild, right? Because one of the things I love about this field, the reason I chose to pursue rheumatology is because of how dynamic it is. We are such a rapidly evolving field with new therapies that are emerging on a very regular basis. New immune pathways are probably being discovered as we speak right now, and new diseases are being named all the time. I mean, because of how quickly technology has progressed, this field has grown immensely in the last 50 years. And I can just foresee continued rapid growth. I mean, every year we're finding new treatments and new indications for existing treatments. It is beautiful to see how much we are learning. I am sure that we're going to have many new treatments that are available for our patients with chronic disease. And what's also great is that autoimmune disease is complicated and no two patients are really ever the same, but we are identifying patients with rheumatic disease more efficiently now. So primary care doctors are kind of picking up on what types of symptoms are concerning for rheumatic illness. They're referring patients to rheumatologists sooner. We are capturing these patients earlier in their disease so we can initiate treatment that can prevent long-term disease. I mean, it's insane to think that even like 30, 40 years ago, patients with rheumatoid arthritis were being treated with NSAIDs, gold injections, and opioids. That was it. 40 years ago, RA was a sentence. There was not much more, but with the advent of biologicals and targeted synthetic DMARDs, we can get these patients started on treatment earlier and give them years and years and years, decades more of just pain-free life. And it's beautiful what we've been able to do. So I can only imagine all the wonderful advances that we have in store for us over the next decade.
I love it. I couldn't agree with you more. And, I was thinking that, yes, we're going to have new medicines. Yes, we're going to be able to treat patients earlier and better. And yet, I think the self-management tools that we talked about, I can't imagine that they're going to go away and that they're going to be any different, because the role of exercise and nutrition and sleep and stress management are still going to be at the core of being a healthy person. So I think it's so important to address those now and learn how to, I tell patients, you have to learn how to sort of manage your body and what it is that your body needs to be healthy in order to have a healthy life going forward.
Absolutely. We did a podcast a couple weeks ago on CAR T cells, and that was just a fabulous, fabulous talk. And even when I was listening to that, I'm like, this is just incredible how far we have come. And we're using CAR T cells in multiple different autoimmune diseases. But as you said, no matter how fancy our treatments get, we have to get back to the basics. And these guidelines are not just for patients with rheumatic disease, right? They're for any patient with any type of chronic disease, and for even patients that are not even patients yet, right? For people that are just otherwise healthy. You want to start incorporating all of this into your daily life to try to make sure that we live a long, healthy life. I tell my patients, I want you to live a long life, but not a long, painful one, right? I don't want you to be crippled and have deformities and not be able to function. We want to make sure that you are functional and have a good quality of life, because ultimately the beauty of life is being able to do all the things that we are doing when we're healthy, right?
Love it. That and a downward dog.
Exactly. I love it. I love it. So get into doing all these additional modalities of treatment. Life is fragile and it can be difficult when you have a rheumatic illness, but there are things that can be done to help you feel better. So you're not going to see results overnight. Doing one 30-minute yoga class isn't going to suddenly make you feel 100 times better, but we want to just continue with doing these things regularly. So whether it's yoga, meditation, deep breathing, journaling, taking your medications, talking to your family and friends about what you're going through, making sure you're sleeping well, eating well. These are all things that you want to slowly incorporate into your life. And the biggest thing as physicians and providers that we can do is give our patients these tools, make them aware that these are things that they can do to help themselves manage their disease. Self-management is just that. Empower your patients to take ownership of their condition, because when they feel like it is in their hands, they are going to be more likely to take action to help them feel better and get onto a more rapid road to recovery.
I couldn't have said it better myself. Bhakti, this has been a really wonderful conversation. I'm going to start doing some yoga now and try to manage my stress that way. But this has been wonderful. I really appreciate your time. And I hope that everybody gets involved with Rheumatic Disease Awareness Month, that it is in September. And we'll have resources on the acronair.org website. And you can also check out the rheumatology.org website. Thanks so much.
Thank you so much, John.
Well, there you have it. Now you know the importance of self-management for patients with rheumatic disease. She discussed how lifestyle changes, medication adherence, and a strong support system can significantly improve the quality of life for those affected. I think that these themes are important not just for patients, but also for the healthcare team that cares for them. Thank you all for listening, downloading, subscribing to our show, and for rating us with 5 stars, or however many stars you think we deserve. You can find our show notes for this and all the other episodes at acronair.org, Apple Podcast, Spotify, and on your favorite podcast app. Until next time, use these tools to empower your patients and yourselves. And of course, stay healthy.